As a pediatrician, I see many cases of ear infections, of earaches, especially during the winter, but it can happen also during the summer. Why is it so common in children to have ear infections? First of all, let's see what it is, an ear infection. Let's look at this model. An ear infection is an infection that is in this area of the auditory system, which is the middle ear. The middle ear is in between the external ear, which is the ear canal, and the eustachian tube, which is the canal that the pipe that brings normally the secretion that forms inside the middle ear and goes where? Into the throat. So if everything works perfectly well, even if a child has a cold, an ear infection doesn't happen because the germs and the secretions that come from the middle ear, they go through the eustachian tube into the throat. When a child has a particularly strong cold, the eustachian tube can get obstructed. They can get very tight so that the secretions from the middle ear cannot go through. They stagnate, they remain there, they get infected with bacteria, and you get an ear infection. It's very painful because it pushes on the eardrum, which is this one, and the eardrum can perforate. If the infection here is strong enough, the infection can push the eardrum and the pus comes out of the ear canal. Is this something serious? Not really. It's not serious today because an ear infection can be relatively easily treated. It can be treated with antibiotics. Antibiotics cure the ear infection if they are well chosen. So one ear infection once in a while is not a big problem. It is actually something banal today because it gets very easily treated with antibiotics. But how about those children that can start having one ear infection after another, recurrent ear infections? Why does that happen and what can we do for it? Well, this happens because of what I said before, because their ear canal is more easily obstructed by either the mucosa that gets very swollen, or because of the secretions, or because the child is allergic or is anatomically a bit defective, especially in the first few years of life. So sometimes I see little children that have one infection after another 5, 6, 7 times in a row. It's very worrying for the parents and it's quite a nuisance. If this happens, there are things that one can do besides treating the ear infections every time it comes, because it's much more dangerous and risky to let the ear infection go untreated than the use of antibiotics. Actually, there is a way of in which one can prevent ear infections, and the only way that I can see it works is giving these small children small amounts of antibiotics, tiny amounts of antibiotics every day for a period of time, which means using antibiotics prophylactically, as a prophylaxis. Is there any other way? We should keep these children from going to school, from staying with other children, from getting colds. I don't think it's a good idea. Better to give antibiotics.